I've been reading a bit into we of course know about the issues within our public health sector, but I've also been looking at the complaints level that the health insurance here in South Africa and the level of service that people have been receiving from private medical aids. And it was particularly around the issue around cancer treatment. We're looking at the state of cancer treatment in the public and the private sector. In Gauteng alone, in 2021, you have people who have waited for up to 5 years for treatment of various forms of cancer. Almost 3,000 people with prostate, breast, cervical, colon cancer are waiting for radiation treatment in one hospital alone in Gauteng, the Charlotte Maxeke Academic Hospital in Johannesburg. That there has been a significant amount of resources, budget allocated for radiation oncology. In 2023, 784 million rand was allocated for radiation oncology services. But according to reports, no cancer patients had received treatment by April 2024. The head of the Charlotte Maxeke Hospital said that even if they had more radiation equipment, they wouldn't be able to use them because there's not enough staff to operate the current number of machines. And that's why they can't get patients on radiation fast enough. The health journalism publication Becky Sisa, they visited hospitals with patients, and they compared that with the state and private facilities. And I'm joined by Salome Meyer now, who's the director of the Cancer Alliance. Good morning, Salome. Really appreciate your time. We have thousands of South Africans who use the public sector waiting for oncology treatment, cancer treatment. I mentioned one figure, 3,000 people at Charlotte Maxeke Academic Hospital alone waiting for radiation treatment. What is currently the state in our public sector when it comes to people awaiting cancer treatment?
Good morning to you and to our listeners, and let's hope, yes, that 2025 will be a better year for those patients. Unfortunately, as you say, yes, it is completely true that 86% of the population access the public sector, and therefore they have to access cancer services in the public sector. I think what we need to say is that not all provinces have got the ability to perform all the types of cancer treatments that can be performed. There are some provinces, such as Northwest, Limpopo, and Mpumalanga, for instance, that do not have any radiation capacity. That means that those patients need to go to the neighboring provinces. We also are fortunate enough, and you must hear what I'm saying, fortunate enough, that a province such as Northern Cape has actually started with outsourcing of radiation therapy, and that means those patients doesn't have to travel to Bloemfontein any longer. A province such as the Western Cape is actually fully catered for and actually very, I want to say from a cancer perspective, very healthy. And I do want to say this at the very beginning of a new year. We need to actually salute every single healthcare professional that works within the public service in cancer care in this country, because they work under enormous strain and they provide an excellent service. What we do have now is budget austerity, and that comes across all the provinces, irrespective of which province it is. That means that the staff, you're not allowed to actually appoint any more staff, and you have budget cuts, and that would also impact on the medicines, meaning that you can't actually extend your cancer medicines in many of the provinces. And that is actually then a really a terrible state of affairs. And I always say to people, we are very grateful for the fact that we do not have power cuts anymore. But have we actually thought where that money went to? That money is now where our health cuts, and our education cuts are. And that's how the general public is being affected by the actual state of affairs in this country.
Talk to me about the number of cancer diagnoses, which appears to be increasing. So, which means there's a higher demand for services, but limited resources to action those services.
Correct. The cancer is on the increase drastically and will increase by more than twofold by 2030 and beyond that even more. And the reason for that is there's lots of reasons. First of all, the fact that people have got better access to healthcare to be diagnosed and screened is actually one of them. However, we do know that aspects such as, or cancer such as cervical cancer will increase drastically because of the human papilloma virus. Yes, we are vaccinating, but we are only going to see the effects in about 20 years' time. And what we're now seeing is that people living with HIV are far more susceptible for cancers such as your cervical cancers, also your cancers related to HIV, which would also be your lymphomas, are on the very, very much on the increase. Then we, of course, have prostate cancer that will be increasing drastically. Again, there we have the situation that men do not have health-seeking behavior, and therefore they will be walking with symptoms of prostate cancer or even early prostate cancer for a long time before seeking any treatment. And that is actually so terrible because those are the cancers that are very, very manageable if you actually diagnose them at a very early stage. It is the late stage disease that causes such a lot of problems.
We know that the burden of the healthcare system falls on the 86 people, as you say, 86% of South Africans who rely on a public healthcare system. But let's talk quickly about the private sector. And I have anecdotal experience from people that I know at least two people who have been medical aid members and for various reasons were denied treatment based on the policies of the healthcare provider, the insurance provider. How is the private sector stacking up when it comes? Of course, they have the lesser burden on the number of people, but talk to me about whether the private sector is also coping.
Well, I think we need to also put the record straight there. At the moment, the private sector, in terms of the number of cases that they actually present, are about, the same as what the public sector present, because it's just because of the lesser number of people in the public sector that come forward, for their cancers. However, in the private sector, we have the situation that 80% of the healthcare professionals service those 14%. So therefore, the services in the private sector is far, far better than what it is. And also the access to their medicines. Yes, that is completely true that many of the 71 medical schemes that there are in this country, which is completely too many, do exclude the higher cost medicines, so there are medicines that can put you out, for like 85,000 Rand per treatment. And then you need about anything between 6 to 10 treatments for your cancer. So you can make that sum. That is going to cost you a fortune. You'll have to bond your house.
So then what role could a NHI, a National Health Insurance, play a role, particularly in, as you say, the Northern Cape has already started outsourcing oncology, cancer treatments to private sector companies and entities. What role could the NHI play in dealing with a quite a real severe backlog. And let's be honest, it's going to be 10, 15 years before we see possibly a full implementation of a national health insurance. But how could there be a greater and mutual cooperation between the public and a private sector when it comes to cancer treatment?
We firmly believe that the equalization of the playing field is one of the most important things that should happen. And that is why the Cancer Alliance is actually asking for the establishment of a National Cancer Institute in this country. A National Cancer Institute would then play the role of a coordinating body that would actually bring the public and the private sector together, and first of all, start with the standardization of treatment guidelines. At the moment, just think about that. We've got 9 provinces, then we've got 71 medical schemes. And then you still have 2 managed care organizations. And if you add all of that up, that is 80-something different treatment guidelines that differentiate cancer treatment. And what we are saying, no, that shouldn't be. It should be one cancer treatment for all the various cancers. Now, I mean, cancer, you've got 300 cancers. We're not saying you need it for all 300, but what we're saying for the major cancers in this country, we need that standardization so that we can also then start determining what are the treatment guidelines, what are the actual medicines
Salome,
required.
unfortunately, I have to leave it there, but thank you so much for the conversation.